Hi, everyone. And thank you, Magnus, for inviting me again. I've been enjoying these twice a month, I think, or twice a year presentations. The one in Paris was really fun last year. So, yeah, we've had some amazing presentations today, and it has been really enjoyable. And today in Dubai, we are celebrating Eid. So, actually, it's a holiday. So, I'm just going up and down, talking to my husband, and, just being basically, trying to handle other things here as well. Anyway, so I serve as an external examiner and principal tutor, as rightly mentioned about me. And I am also a clinical reflexologist and a manual lymphatic drainage therapist. I also studied kinesiology, jiu-jitsu, NLP, hypnotherapy, timeline, and a lot of things. So as I remember when Martin was speaking at the very beginning, she did mention that you do need several modalities sometimes, and that really clicked in me. Because when I first started my career as a clinical aromatherapist, I was really clinically orientated at the beginning. And I didn't think about, working on a spiritual level or an emotional level with my clients. And this really taught me a big lesson, 27 years of my practice. And I work a lot with emotions. And, that was the reason I asked the question if the emotions are related to an organ and things like that, because I really think that they are, as far as my experience is concerned. So this has been my journey coming from Hong Kong to Dubai in 1997 and opening the first aromatherapy center here, which was a really big challenge. They still don't understand aromatherapy here. They're still trying to embrace alternative therapies here. And hopefully one day we will get there. Sorry, I'm not sure why it's not working. Sorry. So we're talking about aromatherapy and birth. Now, the reason I'm touching on this subject is because my daughter just recently made me a grandmother in January this year. And it kind of piqued my interest because I really thought about, aromatherapy works in a lot of ways. And birthing is one of them that is quite exceptional because a lot of women endure so much pain during their birth and especially during the delivery process. So today's birthing actually has empowered women with choices from epidurals to elective C-sections. I see a lot of people having elective C-sections nowadays, which I think it's all, to do with the world today, the way the doctors tell them that, you don't need to spoil anything down there. You should be fine. Everything will be okay. And, just go ahead with the C-section. You'll recover really quickly. And I do see a lot of women opting for C-sections today as well, which is actually quite sad because with aromatherapy, and as you'll see with my whole presentation today, that aromatherapy using essential oils as plant medicine, it does really help to alleviate pain and most of all to make the woman really completely calm and relaxed as far as the birthing process is concerned. So nowadays, actually, a lot of people's, mostly it's in Europe, in England, in America, that complementary approach is really taking place, which is aromatherapy in modern medicine. So as I mentioned, this presentation explores how essential oils can gently support a natural birth. And starting from the second trimester, I'm not saying that you cannot use essential oils in the first trimester, you can. But you really have to be qualified to be able to do that because there are certain essential oils that are emmenagogue and then it can create menstruation. So we do not want to use certain oils that may have a problem, especially if it is your first child, even your second child, you don't want to go there with any of these problems. So we start on the second trimester, even for those who want to choose conventional medicine. I don't know why I'm having a problem, sorry, with my... I can't seem to... I'm sorry, I can't seem to move the slide. Yeah. Sorry, by the end of the session, you will understand how aromatherapy supports pregnancy and labor. It will also identify safe and effective essential oils from the second trimester onwards. And of course, we will also review some case studies that I have highlighting practical applications. And we will also learn how to use essential oils across the different stages that are during the labor. I'm sorry, Dr. Selvin, I don't know if you can control this, but I'm unable to move to the next slide.
Sorry, ma'am, actually, we are not having your slide.
I
You
did send
itself
it.
have to control. I think you can press down
Okay.
arrow. Yes.
I did that.
Yes,
Okay,
yes.
thank you.
Exactly. Thank you.
Okay, so a glimpse into the past. So let's talk about the time when women were actually pregnant in the 19th century. There was a very woman-supported drug-free process. Aromatic herbs and plants were used to ease pain and calm the nerves. The discovery of nitrox oxide in 1772 led to experimental use of chloroform and morphine, often resulting in severe complications. So one such method, which was called twilight sleep, rendered mothers semi-unconscious, but at the cost of significant maternal and infant risk. Then we went into a medicalization of using this kind of, sessions for birth. So as men dominated medical science, childbirth shifted towards pharmacological control, which pretty much is also today, but not as much as I would think. Pain and fear became conditioned expectations. And then in the 30s, Dr. Grantley Dick Reed, he observed that fear intensified pain, leading to the concept of fear, tension, and pain syndrome. And this led to the new childbirth methods like the Lamaze technique, which I'm sure you've all heard of today. And that encouraged mental and physical preparation. So Lamaze actually did an amazing technique that actually helped to control pain. Dr. Fernand Lamaze in the 60s popularized the Lamaze technique. He gave confidence back to women, which I think was really lacking because men were actually taking control by using the twilight sleep and a lot of other different methods for birth control and pain. So this is all about breathing and relaxation. Techniques like rhythmic breathing, focused concentration, massage movements. Massage has become very popular now in actually giving birth. And position changes, visualizations were also taught a lot to women to really calm themselves, to really prepare themselves for birth. And this technique was really about understanding the entire birth process, which women didn't know about. They were really fear-based at that time. So Lamaze taught them how to do this, and including postpartum recovery as well, breastfeeding, and so much more. So the Lamaze technique still lives today. Sorry, I'm having problems again. I'm sorry, it's not moving.
I think you are using PDF, right? Not PPT.
Yes, it's PDF.
Okay. So you just click the slide and press the down button again once.
I did. Okay, got it.
Yeah, it will.
Thank you. Yeah, thank you. So revival of natural practices. So by the late 1940s, breathing techniques and massage became popular, talking about Lamaze again, and it really helped with the pain management. And in recent decades, aromatherapy has resurged as a credible supportive therapy during pregnancy and birth. Women today are reclaiming control using essential oils to manage pain and emotions. So it is absolutely amazing. So I'm going to click on the slide and then I'll press down. Perfect, it works. So why do we choose aromatherapy? It offers a natural, non-invasive option for easing pain and anxiety. That is the number one priority. It also encourages a peaceful, supportive birthing environment. So when we're in the birthing room, we're so nervous. Can you just imagine how chaotic it is in that environment when you're trying to deliver, let's say if it's your firstborn child, you're so nervous, there's so much anxiety. So this also helps to regulate hormonal activity. Essential oils have estrogen, progesterone-based chemical constituents in it, can actually help the hormone activity and to support the body's natural rhythm energy. It also strengthens our emotional connection between the mother, the baby, and the partner, because it's always the three of them. And sometimes the midwife also comes in and, supports, which has really been happening quite a lot recently, especially in the UK, in the NHS system. We do have a lot of midwives now resorting to aromatherapy in the birthing rooms. So aromatherapy combines olfactory and tactile stimulation because it's all to do with our sense of smell, and is also engaging our nervous system through touch and scent. And essential oils are really highly concentrated plant extracts with therapeutic benefits. So you've got to be really careful when you choose certain essential oils, especially for a woman who's pregnant, because her sense of smell is highly, highly elevated during that time. And anything that she loved the smell of before, she absolutely hates it during that time. And I'm sure any of you who've had children may be able to relate to that. Proven benefits of aromatherapy. It helps to create a calm, low-stress environment conducive to labor. The most important thing is that it promotes oxytocin release, which are our happy hormones, which enhances also the uterine contractions and labor progression. This also assists in managing pain, anxiety, which is number one in any woman who's giving birth, emotional overwhelm during various stages of birth and pregnancy. Normally, as I mentioned at the beginning, we start at the second trimester because it's safer up to 3 months of pregnancy. It's considered safe to begin using essential oils in a diluted form, okay? So please understand that when a woman is pregnant, because it's also going to get to the fetus of the child, you do need to dilute it really quite well. And we have certain dilution rates that we use, especially for women who are pregnant and babies, children, and so forth, and the elderly. So topical application via massage really supports absorption through the skin into the bloodstream. Because when I massage something into my skin, into my blood, it will go into my blood barrier system and it will attach itself into the bloodstream and carry itself. That's how essential oils work, to the target organ that it is required to help. So if I'm helping somebody who's having contractions, for example, it depends on my choice of essential oils that I'm going to use and apply that on the skin into the blood barrier system instead of inhalation. But if a person was really anxious and having a total freak out, I would definitely then use an inhalation method because that goes straight into the limbic system in the brain. The thalamus, the hypothalamus sit there, and it absolutely calms the person down pretty much immediately, because our sense of smell as human beings is quite amazing. So we use safe, gentle oils during the stage, which include lavender, which is Lavandula angustifolia. This helps to soothe and promote sleep. Sleep is something that also a lot of women, especially in the last trimester, go through, and it's quite horrendous. Neroli, which is Citrus aurantium, var amara. This balances our mood, which is so important, because imagine the hormones fluctuating all over the place. You're crying, you're shouting 1 minute, you're angry 1 second, then you're happy 1 minute. So, these are the oils that you need to use to actually help balance the mood of the woman giving birth. And mandarin, which is Citrus reculata, it uplifts and also helps in digestion, because a lot of gas, bloat, especially the last trimester of pregnancy, there is a lot going on in the woman's body. And these oils offer anxiolytic, anti-anxiety, and mild sedative effects. It's ideal for nurturing the body and mind during early pregnancy. Now, I always say this to a lot of women who would like to try alternative therapies during their pregnancy. So early familiarity is very important, because when women who begin using essential oils early in pregnancy tend to respond better during labor. The scent becomes a calming trigger and the brain associates with its safety. It helps to manage sensory overload during high stress moments like labor. And as I mentioned earlier, the olfactory system is very, very sensitive during this time. And so we need to choose our oils wisely. So I normally ask women what their likes and dislikes are. And we use about 300 different types of essential oils and even more. New essential oils are coming out into the market nowadays. We need to check for safety, efficacy, and so many things before we actually apply it on somebody in that kind of a sensitive position, especially a woman having a baby. So these are the oils that are pretty safe to use during labor. They're Rose Damascena, one of the most expensive and beautiful essential oils. This actually enhances our emotional resilience. It gives us resilience. It's very uplifting, and it is a uterine tonic, which is so important during the time of birth. Lavandula angustifolia is an all-rounder. I'm sure you've all smelled lavender or used lavender in some form in your pillow or in a bath, or just a couple of drops in a tissue and tucking it into your breast pocket is just one of the all-rounder essential oils that one must have. This, of course, calms the mind. It eases also the uterine and muscular pain, which is something that women have, especially in the third trimester. The legs get really heavy and you start getting a lot of restless leg syndrome and things like that. So this also helps to control the pain. Salvia sclaria, which is clary sage, it really is one of the best oils. But this one you need to be a little careful to use because it eases tension, but it's all, especially if a person has been having anesthesia, if it's obviously a C-section, you have to be careful because this is a euphoric essential oil and actually kind of makes you hallucinate as well. So we do have a safety here that if you are drinking alcohol, for example, at night, you do not use clary sage because it will enhance the alcoholic effect in your body. So clary sage was used in the olden days a lot for fumigation processes, you know, like amongst the shamans and things like that for that euphoric effect. Now, this oil is really, really important, which is Jasmine officinalis, jasmine. It really stimulates the contractions. It dulls the pain, which is so important, and it supports the placenta expulsion. So, you know, the afterbirth. So once you have delivered the baby, when you place jasmine on the abdominal region, it will actually help to remove the placenta. Then, of course, we have our beautiful neroli, which is orange blossom from the orange tree. The orange tree has 3 essential oils, which is sweet orange, petit grain from the leaves, and then neroli from the white flowers. So it's a beautiful, beautiful tree to have if you can grow that in your kind of climate, because in Dubai we can't. This promotes calm breathing and it also reduces panic and anxiety. And then we go Pelargonium graveolens, which is geranium. This also uplifts and encourages circulation. It supports steady breathing. And ilang ilang. Some like it, some don't like the smell of ilang ilang. Cananga odorata. This helps to lower blood pressure, and it is a great one to alleviate, again, anxiety and fear. So if you've seen some of these oils, we mention anxiety and fear here quite a lot because, again, remember going back to Lamaze, that was what women were going through. So a lot of things happen when you're actually at the time of giving a birth. So the first stage of labor, which is really very early birth or the early contractions, we actually try to encourage a woman to have a warm bath with 2 to 3 drops of lavender and soak for 10 to 15 minutes. And then also we apply a gentle massage to the lower back and the abdominal region using lavender and jasmine. As you can see here on the left-hand corner, I've got a blend here, which we call the early or the Labor Day massage oil, where we use 5 drops of lavender, 5 drops of jasmine. We can mix it in 50 ml of sweet almond oil, and this is a 1% dilution. And that is the reason when we make certain blends, we have to be really careful with the safety because it is going to the fetus as well. So we really have to be careful what dilution rate we're using, and we must blend it with a base oil for it to be a carrier oil to go into the skin, into the blood barrier system. So this is the blend that I make for a lot of women, and I only ask them to use it when they have a start of contractions or a show or the water bag breaks, something happens that's drastic and they are going into labor. Also using inhalation techniques such as placing drops on the tissue is a very beneficial method of using an essential oil. Or you also have these inhalers that you can get. And also during this first stage, encourage the woman to stay mobile, but conserve her energy and rest between contractions, because people have had contractions for even 12 to 16 hours. Then we go into the advanced first stage of labor, and contractions really intensify during this stage. So we need to combine our techniques for better results. So we can use compresses with 2 to 3 drops of either lavender, jasmine, or clary sage, diluted in about 300 ml of water. And we apply it to the neck, to the back, to the abdominal region. And this also helps to soothe the woman down, the mother-to-be actually. If permitted, soak in the bath water if it's allowed. It all depends on the hospital that you're giving birth. People even have home water births as well. So it really depends where you are. Continue using the massage blend from the earlier stage to help manage pain, because jasmine and lavender work very well in pain management. Optimal support comes from a combination of massage, compress, and inhalations. You cannot just do one single thing. It's a whole round of things that's going on at this stage. And then we go into the transition stage of labor. This is the most intensive phase before pushing begins, because the cervix is not fully dilated yet. Mothers may feel emotional, shaky, or physically overwhelmed, particularly in the legs. Gently massage the legs with the previous prepared aromatic oil blend to soothe muscle tension. So that's the jasmine and the lavender. And then you can also apply a cool compress with either rose, neroli, or lavender. Choose one to the face. Floral waters are really excellent during this time. And if you're living in Europe or something, it's very easily available. But to import floral waters here to the UAE is very expensive, because you're basically bringing in water. And, floral waters are the byproduct of essential oils, distillation. Then the second stage of labor, this is the pushing phase. Now the cervix has become fully dilated, and the urge to push becomes strong and instinctual. Breathing techniques are really critical, like the Lamaze technique. Support with neroli or mandarin, inhalation via tissue or personal inhaler. And then use cool compresses. So cool it with some ice, maybe in a bowl. Put a couple of cubes of ice. Put 1 or 2 drops of lavender in there, and then just rub it on her face or the lower back to maintain calm and to reduce the overheating, because this is what happens. Now, the birth and third stage of pregnancy. So this is after delivery. So remember, I mentioned jasmine as a compress to be used on the abdomen to support natural expulsion of the placenta. And you need to reapply this a few times. A lot of the midwives in the UK, in the NHS system, actually do this, and they're used to doing it because it is the afterbirth and it should be expelled normally unless you've had a C-section. It's different, okay? And then continue scenting the environment to promote a soothing, grounding postpartum atmosphere. Remember, there's a lot going on at this time when the baby's just come and is on top of the mom. And, there's like a sigh of relief, and there's so much movement going on in the room, the doctors, the nurses, the midwives, the mom, the dad, and now the baby. So essential oils also actually help to support the perineal healing and help stabilize emotions in the early postpartum period. Really, really good for continuing into it afterwards. So these are 2 blends that I'm just sharing with you, which I do for a lot of my clients. The stretch mark, of course, everybody gets stretch mark because they're obviously expanding. The abdomen is expanding. So 5 drops of lavender and 5 drops of mandarin, which is vercutilata. We can put it into 50 ml of sweet almond oil. If you have any other base oil like apricot kernel, jojoba, wheat germ, any nice base oil, it'll also do. But try to use a light one. You don't really need to use any heavy base oils. And you apply this twice a day. From the second trimester onwards, it should be good. Even from 5 months onwards is fine to avoid any stretch marks. Then, of course, if women have C-sections, this is only after the doctor has approved that you can use this blend, which is a drop of helichrysum and 1 drop of lavender into 10 ml of sweet almond oil in a 2% dilution. and use it twice a day over the scar. And this will actually reduce the scar tremendously. But this is only once the scar is healed and the doctor said it's fine, go ahead, no issues. By all means, use it. So how do we use essential oils safely? You always dilute essential oils before use. Never apply undiluted essential oils directly to the skin. Of course, we all know that lavender and tea tree can be applied directly on the skin. So let's say if a bee stings you, you can put a drop of lavender on your skin. That's for emergency as a first aid. But on the overall experience, always dilute your essential oils because they're very highly potent. And for inhalation, always only use 1 to 2 drops on a tissue or in an inhaler. And when you're creating a massage blend, maintain a 1% dilution for pregnancy, approximately 1 drop essential oil per 5 ml, which is like a teaspoon of a base oil. Avoid clary sage before labor begins due to its uterine stimulating effects. So it's really good to use it once there is a show or water bag breaks, and that really helps to move on the pregnancy. And it's always good to have a patch test, especially when somebody who's new trying to use essential oils for the first time. We can, use it on the inside of the elbow here to do a little patch test for any allergies or sensitivities in advance before a woman decides that, hey, I would like to continue with aromatherapy during my pregnancy or whichever treatment that they're coming to see you for using essential oils. I'm going to share 2 of my case studies that I have. This is a Mrs. A. She's age 34. It's her first child, and it was a vaginal birth. So she began aromatherapy at 14 weeks. And what I was using was lavender, mandarin, and neroli with her. She reported reduced anxiety because being her first child, she was an extremely anxious person. And she really worried about everything, worried about going to the doctors, worried about what's happening, worried about if the child is growing properly. And you know how it is. There's 100 million things going on in a person's mind, especially if it's a first pregnancy. She couldn't sleep very well. So also this helped her with her sleep. And it also was to help to have a smooth labor experience. So she used to come to me bi-weekly, so twice in a month. And in the second trimester, she increased to weekly treatments in the third trimester. I made a lot of different blends for her, including stretch mark blends and personal inhalers to help with her anxiety because she was very, very anxious to manage a late trimester anxiety because the closer she got to the dates, the more she worried, the more she fretted about it, the more she agitated. She was actually a very, very anxious person. So I think neroli was the one that actually kicked in and helped her to really be calm and accept what's happening to her body. She avoided the epidural entirely and delivered within hours of the onset of contractions, aided by midwife-guided aromatherapy, which was amazing for her because she was so stressed about the long contraction period. Then another case study is Mrs. S. She's aged 28, also first child, unfortunately C-section. She started aromatherapy in the second trimester and was very highly responsive to scent therapy. She loved essential oils. She loved the scent. I mean, she loved using perfumes of all sorts and stuff. So for her, obviously, aromatherapy was like amazing. She attended weekly massages, and we use essential oils such as neroli and petite grain, which is Citrus aurantium amara, at 1% dilution. We created custom inhalers for home use, especially helpful during disrupted sleep. She had a lot of anxiety as well and couldn't really sleep very well, especially the last trimester when she was getting more and more heavier. She, however, had to deliver via emergency C-section due to a cord complication, which is unfortunate. She recovered well post-surgery and resumed using essential oils for scar care and emotional grounding once medically cleared. Then another case study of a Mrs. M, age 38, which was second pregnancy. She began treatment at 18 weeks, attended sessions twice monthly. Partner and midwife participated, extending aromatherapy support at home. Now, this is so important. If a partner and a midwife can be involved in your whole pregnancy from the second trimester, I mean, you can't ask for anything more. She really had very good support throughout her pregnancy. She managed gestational diabetes during the third trimester. Partner-assisted massage and blend preparation empowered the birthing team dynamic. So I showed the husband how to do the massage for her and how to do the massage actually when she goes into labor. The midwife already knew how to do that, but so that the husband was there because the midwife was not there all the time. So she experienced an 8-hour labor and delivered naturally without epidural or pethidine. So compared to her experience previously, to her first induced labor, this was very far less challenging for her. So aromatherapy in modern hospitals today. So today, a lot of women can make their own decisions. And a lot of medical teams who are trained in emergency C-sections are also creating calming environments with lavender and jasmine oils if they are trained to do so. Hospitals are increasingly adopting integrative birth process practices, blending medical expertise with holistic care. Growing trends include natural births, water births. I know a lot of women having water births at home here in the UAE. They fly them in from the States or from UK, and they're having water births at home. Pretty simple, actually, and it's quite interesting. Hypnobirthing is becoming really popular as well. And of course, aromatherapy assisted labor. So the landscape of maternal care is evolving, offering women more control, comfort, and personalized birth experiences. And as I mentioned, the NHS hospitals in UK, a lot of the nurses are trained. Actually, they are IFPA trained aromatherapists, and they have studied enough to be able to manage, as midwives, to be able to handle certain crises that can happen during birthing process with the women, and being able to make the blends that require actual immediate care pre and post birth as well. In the UK, I have been to hospitals where you get actually reflexologists coming in and doing treatments. Other alternative therapists come in and visit patients, hypnobirthing, hypnotherapy. There's so many alternative therapists actually visiting hospitals in the UK. And I think it's a beautiful experience to go through when you compare it to the good old days, like when women had to suffer. And that's my presentation to you all. Thank you very much, Magnus and Traditional Medicine, for inviting me again.